Mm. Good afternoon, everybody. Hopefully you can all hear me. Hi, Anne-Marie. We're just waiting for the others to connect. Lovely. Okay, so as you know, we're coming to the end of the program. Yay! It feels like it's been going on forever, but it's been 2 years and a bit. So we've got the EV, which is the external verifier, moderating the work which you lot have submitted to me. That's being done, I think, on the 10th or the 11th of June. Okay. What happens after that is I get a report from the external verifier and they will say, yeah, no problems. Or they'll go, yeah, look, actually, we just need a bit more evidence here, here, or here. Okay, so we won't know until that's done because you were the first cohort going through this qualification, and then you were the last because they then moved it over to universities, which was again another wonderful move from our lovely government. Anyway, just thinking politics are coming up. No, time for voting. So where we're at, the level 5 diplomas are banked for you guys. Now, we need to move you on to the endpoint assessment. So once your diploma has been issued, you have a 3-month window for the examiner to contact you and they will book the exam with you. Okay, so it's nothing to do with us. We don't get involved in it at all. You'll get a phone call from NCFE Cash, who are the awarding body for your diploma. They are also the endpoint assessment organisation, so the independent people. They'll give you a call and they will book it in with you. And it must be within 3 months of once we've got you ready, basically. Okay. If you want to do it a bit quicker, you can. If you want to just postpone it a bit, you can. It's led by you as apprentices. Now, just so you're aware, this is the apprenticeship standard that you have done. It has got on here that it is retired. That's because this was the one that was retired and now it's done by universities. So there's no point looking at the other one, because if you look at the other one, it looks exactly the same, but it's for universities. Okay, so this is the standard you've done. You won't get retired on your qualification, obviously. So just to remind you what we did. So through your diploma and through the online learning and through the CHAPS program that you did, all of those short courses with those multiple choice exams and me coming out doing all those practical skills with you, and you kicking my backside around the place when we do control and strength, just saying, some people choked me quite well. We just need to make sure that we're up to date with some of the stuff in our heads. So the first thing that you covered was about understanding how to assess patients, the processes, conducting person-centered care plans, and that review process. And if you remember, you did your nursing assessments and you did your care planning module bits. Yeah. We then moved into care planning and making sure that you understood people's rights. That then looks at safeguarding, consent, capacity, and all of those frameworks. So you did that in your online learning. We then look at, hang on, that's not the right one. That's the associate. Let me start again. Hang on. You have done all of that, and that does sound like the new one. And the other one has been retired, but that's not the continuing healthcare practitioner. That's the new one that we've replaced it with. Hang on. That'll have confused you all. We'd have got to the end of that, and you'd have been like, is that all it is? There it is, assistant practitioner. And let's scroll down. So this is the one you've done. And we click that one. So again, looks exactly the same. Still retired. So we did roles and responsibilities. We did case management. So that's again what we've just talked about. You did those roles and responsibilities and all of that lot. Good. You had to do, and if you remember rightly, you had to at least 4 patients end to end where you had to show me that journey. But we've done it through the care planning. We've done lots of clinical stuff. And again, in your write-ups and your professional discussions, you spoke to me about people you've supported. So you then think about your supervision and teaching. So you all completed the online Higher Education England's Assessors Award for the Care Certificate. Yeah, remember doing that? All online, you got your care certificate assessors, good. You then look at professional development. So that was, we did a professional discussion around that about your own professional development. I think we talked about Gibbs and Ralph's reflective cycles of learning. Teamwork, if you remember, we covered that in the professional discussion when we talked about different teaching and about different leadership styles. We covered about the inclusive leader and stuff like that. Care planning, puzzles and stuff we've done. Communication, we looked at the accessible information standards, we looked at different types of assessments, and we looked at different ways of communicating. Person-centered care, we did that as a module at the beginning. You've done that. You do that all as your MVQ. You do that anyway, right, in care. Vital signs. Now, this is the bit, and this is really the bit that I think they can only examine you on, because it's the only practical skill there, is the physiological measurements. So vital signs then is blood pressure, temperature, pulse, respiration, levels of unconsciousness, give or take glucose. So when you do your end exam and you have to book an episode of care, I would recommend you monitor people's vital signs, because it's a clinical skill. You're all confident and competent at that, and you do it all day long. But don't forget, you must be able to score them. So you must do that must score, and then you must know what to do with that must score. Risk assessments, you've all done your risk assessment stuff. We know about the risk assessments online. Equality and diversity, which again, you did a module online and you did your multiple choice question stuff, and then quality. So that in essence is all you can be examined on. The multiple choice exam, the professional discussion and the observation can only be on those topics. So it's not going to be anything else. Okay. So what's going to happen after the 10th of June, hopefully the EQA will let us know that the certificates can be released, or they'll give us some things to do and a deadline. So the certificates will be released maybe July time, sorry, give or take, because this is quite a busy time for them with GCSEs and exams. So they'll say your certificates are released on this date. We will tell you when that date is, and then you could be moved into Gateway, and then it's up to you from there on after. So we just need to make sure that you've got your maths and English done before that. And we need a copy of your, I don't need a copy of your DBS, I just need your DBS number. Okay, because you're all currently and you're all working, I am going to trust your employer that they've checked your DBSs, because again, you wouldn't be working if you hadn't got a valid DBS. And you've got your industry codes of conduct here that you need to know about. Just make sure that you've read those. And those codes of conduct, do you remember they were on the Skills for Care website, that you can download those? Because I guarantee they will ask you about codes of conduct. And I will put it in this link. So when I put this all together, I'll put a link for the codes of conduct as well, just so I know you've got them. It's only about 9 pages. It's not a massive document. So let's look at the end exam so you know exactly what's happening. Now, again, I will give you this link to the end exam. Okay. So in here, you've got 3 assessment methods. The first one is going to be a multiple choice quest. It's not even a real word, is it? It's not. I'm just making it up now. A multiple choice test with short written answers. You then have your observation, and there is this reflective journal with an interview. So this is the bit I'm going to talk to us about, because you've got a couple of months to prepare for that bit. So as we scroll down, The multiple choice test is graded pass, merit, or distinction. This is what you are going to be tested on. So principles and philosophies of healthcare, which is unit 1. Do you remember that was where we did technology, different types of technology? We looked at ethics in that. It was your very first module, very first lesson that I did with you all. It was a long time ago. So if you go back to your canvas and click on APH1, just refresh your brain. Okay. Then you've got anatomy and physiology. So, and then lifespan development. So, and end of life stuff. Okay, nothing too terrible there. You've got research. So how to conduct research, which you've all done because you've done your essays. You've got promoting of healthcare needs. So the provision and promotion of personal-centered care, safeguarding, which you should all know. You've got the importance of the strategic environment. So that's about compliance in healthcare. So things like CQC, audits and compliancy bits. And then the importance of current evidence-based practice. So, and do you remember throughout the whole course, I have been harping at you, nice guidelines, nice guidelines, nice guidelines. Good. So that's what's going to be the multiple choice test. Hopefully, you know, most of you have done really well on your MCQs anyway, so you should be absolutely fine on that. Then we're going to move to the observations, and the observation is either a pass or a fail. So you're either going to pass this or not pass this. And the observation is something that you are going to plan with the examiner. So it's nothing to do with me. You're going to plan it with the examiner. And what they are going to observe you against is here. And when you look at it, it's not actually that much. Can you communicate with the individual? I hope so, because if you're not, how are you doing it? Can you manage the information and record keeping? I hope so, because where are you recording those must scores and nice guidelines that you're doing? Can you promote a range of techniques to spread to reduce the spread of infection? So in other words, can you wash your hands and put on gloves and aprons? I hope you can all do that. Can you promote and maintain a safe working environment? So if you're using equipment, is it clean? Have I got batteries? Is it pack tested? Just that kind of stuff. And again, identify and manage risk. So that's your risk assessment. So and an example might be my patient's got mental health. I'm not going to do that on my own. I'm going to get a colleague with me because they're a puncher or a scratcher or a biter, whatever it is. I don't know why I'm doing that for a biter. Just seeing if you're listening. Communication and body language, right? Then you're going to demonstrate personal-centered care. So in other words, you do the vital signs on this individual. How is that personal-centered to them? How are you communicating with them? Where are you doing it? Is it the right time of day for them? You're not just doing 4 lots of vital signs for the sake of doing 4 lots of vital signs. You know, Bob likes to be up at, I don't know, 8 o'clock. So I'm going to do his then. Margaret likes to stay in bed till 12. So that's the personal centre bit. Or again, Bob has a medication and his heart rate's up in the morning. So I have to make sure that, you know, it's not right to do it. He needs time. Whatever it is, just think about how you can show that personal centred piece in there. Treat people with respect and dignity. So in other words, you're knocking on the door, you're gaining consent, you're just talking to people with the respect that they deserve. You show empathy towards what you're doing. So in other words, when you're taking vital signs from somebody, you're being gentle, you're talking them through the process, and you're going to explain the results. Not just, ooh, and then walk away, but just say, you know, they're in normal range, they're not in normal range. That's it. You don't have to go into massive details, but empathy is just the fact of, you know, you can say, look, I know you get stressed when we do this, so we're going to do it. I'm going to let you know the results so you're not upset. Okay? Because that's me showing that I care about you. But don't tell anyone that because it's not true. Right. Show discretion and self-awareness. So this is just about you being aware of your own, you know, how you're standing, how you're sitting. So when you're doing somebody's vital signs, are you doing it on their level? You're not leaning over them, you've got good eye contact, you've set the equipment up, you've cleaned it all, and you're going. Do you remember how we said it's kind of like the boats in the night where you sit parallel to somebody so you can see eye contact? Because if you sit at that angle, if you sit in a triangle, you can't actually see somebody properly. Where if you sit kind of like ships in the night, you can see them and you can move if you need to move. And I think we do ships in the night when we talk about communication and theories. Um, Promote multidisciplinary working. So, based on the vital signs, do you now need to do something? Look, Bob, your blood pressure has been 160 over 80 now, and I know that's hypertension. You know, anything over 140, stage 1 hypertension, 150, stage 2, 160, stage 3. We've done this a couple of times. I'm really worried about your blood pressure, Bob. I'm going to refer you to the doctor for some statins. You don't have to say the statins bit, but if you know that that's what it is. Or again, if you're doing their peak flow for breath, you may refer them to the asthma clinic. Whatever it is, whatever you're going to refer them, why you're referring them. Then you're going to provide appropriate leadership within your own role. So that's you just doing everything you should be doing. And then you'll undertake and define a clinical therapeutic intervention appropriately designated by the registered practitioner. So again, vital signs, I think, is a really good intervention. And a therapeutic intervention, if you think about Unit 7, which is your specialist skill for mental health, I've given you access to the YouTube channel, and in there, you've got lots of skills for managing mental health. Do you remember? You've got breathing skills, guiding skills, grounding skills. So that could be a therapeutic thing, because I can say, look, Anne-Marie, I can see you're stressed today. Before we get started, why don't we just do some breathing skills? Let's calm everything down before we do your vital signs. Yeah, and that would be a therapeutic intervention. So it's really not that bad, right? It's whatever you're going to do, you're just going to run through it as if you're doing it. And then finally, your reflective journal. Honestly, it's been a long day. It's been a long day. Your reflective journal is completed 3 months leading up to the endpoint. So you should be doing this now, completing this. And this is, you are going to write about your case management. So that's your 4 patients that you've been working with, and how you supervise and teach, and/or I think it is the appropriate reflects the following components from the standards. Oh yeah, both. So here it says the reflective account must also include evidence of values and behaviours and being applied to the concepts of case management and supervision and teaching. So that is then a pass, merit or distinction grade, and whatever you write about here is what you're going to be interviewed on. So write about some patients that you know about so you can just talk the high legs off the back of the donkey. Because if you write about the people, you know, if you can write about some people you've supported, and if you think about supervision and teaching, if you can write about somebody you have mentored, you're going to fly through that with no problems. Now, there are requirements for that. So we'll talk about those requirements. We've done all the gateway stuff. Multiple choice test we've already talked about. Pass mark is 40%. So that's quite low, right? So if any of you fail that, I'm going to sit there and cry. But don't feel bad if you do, but I will be quiet. And then 60 to 74 merit and 75 that for your distinction. Your observation of practice, look, it's there. It's very clear. And you will prepare it. You will say to the independent assessor what it is you're going to be doing. Look, it is in your normal working activities. So, and you may even just do a care plan. You may do a care plan review. That's a clinical intervention. You don't have to do vital signs. You may want to do some control and restraint techniques. You may want to say to somebody, like a new member of staff, Bob gets really angry. Here's his behaviour plan, and here's the control and restraint techniques. Whatever it is, this is going to be down to you. However, what I will say to you all is not that I'm allowed to help, but if you were to email me, I may be able to look at an email, but I'm not allowed to help. I don't know why I'm nodding on a video camera. It's not very sensible, really. Anyway, and then we've got the reflective journal. So this is the bit that you have to put the work in now, which is you need to produce a 2,000 word plus or minus around the following. So case management, how you manage your own and caseloads at work, and how you supervise and train somebody. Okay? And you have to have that ready to go into Gateway, because the final interview is based upon what you write. Yeah? So if you can write it as if it's what you're currently doing, you're going to fly through this. It's not going to be a problem because it'll come from memory recall. If you start making things up, it's going to be a bit more tricky for you. So again, here is your past merit and distinctions on what they're going to look like. So if you want to get the distinction grade, that's what you've got to be writing. But again, if you want me to review this, all you've got to do is you have to email it to me anyway, because I have to upload it to your Gateway. And you need to be doing that by the end of July. Right. So if we go to the back of the document, you can see how the grading works. If you pass everything, you just get a pass. If you pass if you pass 2 of the outcomes and get a merit, it's still a pass. If you get 2 passes and a distinction, it becomes a merit. And then if you get 3 distinctions, it becomes a distinction. It's a bit odd how it's all worked out. It's probably one of the most complicated grading systems in all the standards we do. But that's how it was done. So what you really need to do over the next 3 months, and it's going to be 3 months before this now comes to an end for you all, go through this document. Make sure you're happy with the assessment methods. You've got a multiple choice test. All of the resources are online. You've got it all there. Okay, just research.
Are you sending this to us, Steve?
Sorry, Anne?
Are you sending this to us?
I'm going to send this to you in an email with the recording, with this, and with that code of practice.
Okay.
Yeah. So the observation, I've seen you all work. I've seen you all do stuff. I know you're all doing it. I've seen your care plans. I've seen your online systems. I've seen how you work. I've seen how you do your clinical skills. I've seen how you can. I'm not worried about this. I think you should all be absolutely fine on this. Just remember, it is those basics. Have I explained the procedure beforehand? Have I washed my hands? Have I got the right environment? Have I explained the procedure? Have I explained what I'm going to do afterwards? And have I recorded it? That's all it is. Yeah. So hopefully you can't fail that bit. And then the reflective account, as long as you're writing about your case management and how you've supervised and trained somebody, you can't really get that wrong either, because they're only going to question you based upon what you write. Yeah? So the deadlines for everything then really is any outstanding functional skills evidence needs to be collected by July, the 1st of July at the latest. So if you need to do a multiple choice test, if you need to do speaking and listening, You can book the speaking and listening with Pat, the multiple choice test I can arrange with you. We just need to get that done. If you've already got it, you don't need to do it. That's that. Your certificates, your diplomas will be hopefully released around the 10th of June, maybe a few days later, or it may be a little bit later than that if there's things that I need to do, because it may not just be you, it's across the cohort. So it's not just necessarily, oh, you've got to do a bit more work. It may be the fact that I've missed something because, again, this was the first time we run this. However, all the standards have been met, so it may just be something there. So once that's done, but now we have to move and say your teaching and learning time has come to an end. You are technically all now in Gateway, which means you have to prepare this journal, and I need that journal completed by the end of July at the absolute latest, because you need to do your EPAs in August. Because some of you are going off to university in the September. So it's a very tight deadline for that. So obviously we want to get you all through and ready. Okay. If there are any problems, let me know. However, it really is down to you guys. Once you've had the message from me that your certificate's been released, it's then down to you. I will let you. I think the EPA emails you, and I think they will phone you. But what I would say is, if you've not had anything by the 1st of July from the awarding body, you need to be contacting me and saying, Steve, I've not had my Gateway interview date set. Because you can see it can take up to 12 weeks from that day. Yeah, based on how busy they are, because it's nothing to do with us. And that's it. We can then put this all to bed. Now, also, you will get your digital certificates from me. The software company is talking to me tomorrow morning at 7:30. So hopefully the system goes live, and then I can issue your digital certificates for your chaps and all your other bits and pieces that you've done. And then that way, because again, when you talk about your own teaching and learning, you can talk about, Jesus Christ, Stephen made us work really hard for this. We had to do all these courses. Here's a copy of my certificates if you want to have a look at it. We've got them online because they're validated, etc., etc., etc. All right. Any questions? No? All happy with that?
The reflective journal,
Yeah.
where is that? Is that going to be on the Gateway?
So the reflective journal, the information on how to write that is here. And that's page 8 of that document. So I will email that to you in a minute.
Yeah.
And that the guidance is here. So you have to produce a written account of 2,000 words plus or minus 10%. So that's 200 words. So you need to answer the following: your case management and supervision training. So logic says 1,000 words for case management, 1,000 words for supervision and teaching.
Okay.
Yeah. It doesn't have to be academic. It is a reflective journal. So in other words, you don't have to do all this stuff where I keep going, where's the evidence? Can you make it sound like the first or third person? You can just write it. This is what I do in my job.
Okay.
Yeah, nice and straightforward. Because ultimately, you don't want to trip yourself up. And when it's marked, it's going to be marked against those standards here. So that's the grading criteria.
Right. Okay.
Oh, mind you, no, look, it does say that you need to use a recognised referencing system. I take that back. You do have to use a referencing system. It says it there, look, use a recognised referencing system. SOS.
God's sake.
Then don't call it a reflective account, call it an essay.
Yeah. So
Okay.
we're like basically doing what we did before.
Yeah. It's there. It says, look, user recognized referencing system. Inaccuracies around grammar and spelling, just use Grammarly, put it through AI, get AI to check it. Because there's no point losing, not getting a pass mark based on that. The bit that's important is your concepts to theory and practice. So that's this bit. So the concepts will be what it is you do. So for example, you could write, we do care planning and we use our online system. The theory to that will be we do a strength-based approach, or we do an outcome-based approach, or we use the enablement approach, or we do a personal-centered approach. That's the theory. Yeah. And if you think about teaching and learning, supervision is going to be around self-reflection. So when I self-reflect and I have my supervision with my employer, this is a CQC requirement. That's the concept. The theory will be I use Gibbs or Ralph. What went well, what didn't go so well, what can I do better next time?
Yes, the teaching theory, isn't it?
Yeah. And then for the teaching part, it will be something like Honey and Mumford. Every learner's got a different learning style.
Yeah.
So some people are practical, some people are hands-on.
Yeah.
That's what that's looking for. You need to make satisfaction connections between learning. That's fine, because that's what that theory will do. And combined evidence demonstrates knowledge, skills, and behaviours of the science met. And then this will then just be you talking about your job role.
Okay.
So just make sure you've referenced a theory to case management and a theory to supervision and teaching, because then you've done that bit. Okay. And then obviously your merit, references systems, spelling and grammar, same thing, connection, same thing. Engaging in activities taken forward to the professional discussion. So I think here it's going to be, when you're having your interview, it will be the analysis and the synthesis. So in other words, you're able to talk about the strengths and weaknesses of each. So for example, you could say an analysis of like Honey Mumford would be, well, the benefit of a theorist is they can cover a lot of written work quite quickly and understand it. The downside is it doesn't mean they can apply it practically.
Yeah.
An activist is a hands-on person that can learn quite quickly, but the downside to that is I don't know why they're doing what they're doing.
Yeah.
So that would be your analysis. Person-centered care planning, this is a great model. It works really well in health and social care. It means that we're going to be meeting things like equality, diversity, and inclusion. The downside to this is it takes a lot of time. And if somebody lacks capacity, they're not able to fill in all those gaps.
Yeah.
Yeah, so that would be your analysis. And that would be on the interview. And then on the discussion then, I think it's a further analysis. So the examiner will probe you a bit more.
Okay.
So it's just more answers you give. All right? Happy with that?
Yep.
I mean, it is what it is, right?
Yeah.
Any problems, you know where I am, WhatsApp me. Try and get this over to me as soon as possible if you want me to look at it. It's not my role to look at it for the off-program part now, because my part as your assessor is we've come to an end. As sad as it is, I know, heartbreaking, right? Heartbreaking. You're all going to miss me. No more squeaky voice. But I will obviously get you through the gateway bit. And then, yeah. And then hopefully once you all qualify, we can have a party.
Hey.
That's the plan. Cool. All happy with that? So if you're happy with that, I'll end this now, and then just keep an eye out for stuff.
Yeah, that's fine.
All right.
You get
No
my
worries.
observations through the email.
Sorry?
Did you get the observations through the email?
I have. Yeah, thanks. Yeah. So I'm going to add those into your portfolio. ready for the EQA.
Brilliant.
Magic, take care. And again, before the EQA visit, because I think you've been selected, haven't you, Anne?
Yes.
Yeah. So before the EQA visit, I will just maybe on the day I'll have a call with you in the morning.
Do you know when it is?
I think it's the 10th of June.
Are they actually coming to my work?
No, it'll just be a phone call.
Oh, thank God for that.
Yeah. And it'll just be about your evidence. Yeah, and
Yeah.
it'll be how have you learned? What have you done? Have you logged on? Did Sina give you feedback? Have you met him? Has he observed you? It's because it's for your diploma. It's not about the apprenticeship. It's not about Ofsted. It is purely about the diploma.
Yeah.
So I'm not worried about that because you've all done it.
Yeah.
All right.
Okay.
Magic, you take care. Have a great evening.
Bye.
Bye.